Whatever you ask, I'm going to answer.
Okay, cool. And if there's anything you just want to share, whatever's on your mind, by all means, feel free. Okay. Where are you from? What are your specialties, and how long have you been nurses?
I have been a nurse for 12 years. I do a little bit of everything from peds to geriatrics, acute, med-surg, tele, everything. Step down. I see everything over the years, and even with agency, you get to do a little bit more. So to be honest, almost every level of care, because I like to try different things. I'm even a board certified case manager, so I know the insurance side. I can admit you, I can discharge you, I can code you, and I can process your paperwork.
What's on your mind and what brings you to the march today?
This has been one of my very best friends. We met in the 9th grade and we did nursing school. We came out here because the last 2 years have been crazy. We were coming to the march regardless. The fact that it's on Nurses Week is even better. The fact that this month is Mental Health Awareness Month means even more. And you know, we said a lot during the march about capping ratios. When you tell lay people, we need to cap ratios, they really don't know what that means. What that means is when you lay in that bed, and if I have too many patients, that means you see less of my face, and that puts you at more risk to die. That's the clean version of it. A lot of people think this is about pay. It's not for me. That's not my priority. Of course, you do need to, pay me what you owe me, especially when you mandate OT. And pay me what I'm worth, because I didn't get this degree out of a Cracker Jack box. I actually worked really, really hard for it. And what we do, robots can't. So we definitely deserve every dollar, and honestly, it's really not enough, because ultimately one of the most meaningful things on here is I still see their faces. I have bagged more dead bodies in the last 2 years than I have in my entire career. I'm here because healthcare as a whole needs change. It's not just about nurses, it's about patients. If we don't have what we need, we can't give you what you need. Do you really want a stressed out nurse helping you? Think about it. You have a patient here for a GI bleed. You have a patient here for nausea and vomiting, and they have electrolyte imbalance. I'm busy. I'm being pulled in 1,000 directions. It's really not that hard to make a mistake. Yes, we scan things in, but machines are not infallible. Things happen. And no, thank God, knock on wood, I've never made that kind of mistake. But when you give people 8, 9, 10, 11, 12 patients, and you put patients that really should be in ICU on med-surg floors, you put us in really bad places. And then when people make mistakes, then you want to send them to jail. When we literally came in, we pledged to do no harm, and we just want to help people. We just want change. And honestly, I'm a little disappointed, because I feel like there's other groups of people that went into this Capitol, acted fool, defaced property, did all kind of stuff, and I feel like it got all kind of media coverage. Their voices were heard, and no one would even come outside and face us when we faced COVID. We literally faced COVID with the same nasty mask, with the same nasty gowns. Literally, sometimes didn't even have supplies. We used to have to soak bleach, baby wipes in bleach. There was a point in which in some facilities they didn't even have gowns. We were wearing trash bags. And if we can get down in the dirt and get it done, you can face us and you can hear us, because without us over the last 2 years, I don't know where anybody would be. And I'm not just going to say just us. I'm going to say nurses. I'm going to say respiratory. I'm going to say CNAs. I'm going to say, who am I forgetting? The lab, dietary, EVS, housekeeping, every part of the hospital. I mean, we all went through it. And we still had to, some of us recover from having COVID, like myself, come back to work. No sympathy for us. So, I mean, nursing can be a wonderful and promising career. And my number one reason is I have a 17-year-old daughter that wants to be a nurse. And I heard myself saying over and over again, no, Kayla, don't be a nurse. Do something else. But you know something? That's not who I am. And that's not what I taught my kid. I taught my kid, you can shoot for beyond the stars, beyond the universe. So you shouldn't not get to be something that you would be so amazing at, because you are so empathetic and compassionate, just because we don't have the correct laws in place. So I'm hoping that this affected some type of change. I'm disappointed that they wouldn't face us. I think nursing is a beautiful career. I've been in it for 12 years. But if there is not change, I don't really know. I may have to make a change, because at the end of the day, how they say on the plane, put your mask on first and then help others. And I feel like we've been putting everyone else's mask on and wearing the same nasty mask and putting ourselves at risk, not taking care of ourselves, and now we're suffering with these things. PTSD, anxiety, depression. We're smiling every day to hide tears. Like it's like a joke when nurses say, all right, y'all ready for a report? Girl, I cried. I cried again today. It's the norm, and it shouldn't be. It shouldn't be. Like, I want to get back to a place in nursing in which we come in, we have what we need, we take care of people, we affect change, and we can go home and have something left for our families. That's pretty much where I'm at.
Yeah. Just to provide context for anybody who's not here, we had, it must have been, how many people would you estimate? How many nurses showed up?
Here today,
couple thousand.
Thousands, yeah. We shut down. I know that Secret Service and police and all them were involved and kind of escorted us through what I believe is one of the busiest roads here in D.C. So kind of shut down D.C. traffic for a couple hours. But yeah, I didn't see any of the politicians come out to even
I actually feel
acknowledge us.
that we had a better response from locals, people walking to work on their lunch break, people catching the bus, because the crazy part about it is they don't make the laws, but they know that ultimately there's a 99.9% chance at some point in your life you do have to be sick and you will be in that bed. Do you really want me to be overwhelmed, stressed, overworked, pulled in 15 directions, or do you want safe staffing, meaning an amount of patients that I can handle appropriately, you know, the medicine in place, you know, the PPE if I need that, you know, the things that I need to take care of this person, working equipment, you know, safety, security, not other people, you know, fighting or abusing us or their family members. I'm more than sure if you're laying in a bed, you don't want to hear someone fighting a nurse in the next room either. They know that from a realistic, everyday standpoint, they could be one of those patients in that bed. And maybe they don't see it that way. Maybe they have personal doctors and nurses. I don't know.
When they come to the hospital, they'll be VIP.
They will be VIP.
Every nurse's nightmare.
Yeah.
VIP.
Yeah.
You said your audience is mostly like new grads.
Yeah, new nursing students, new grads, a kind of a variety, but I really want to capture not just the, you know, the good sides, but also just like the reality of like what we see sometimes. And
new grads don't learn from new grads.
Yeah.
That's one of the scariest things I've ever seen is somebody who is a nurse, has been a nurse for 6 months, training a new grad. Because this is the thing, and I'm not being mean in any way. I know they say nurses eat their young, but you need those seasoned spicy like crawfish. I'm from New Orleans. I love crawfish.
You have your life, you have your patients, and then
you need
have
that
to watch their
seasoned
patients
nurse
too,
to teach
so you have another additional load. Of patients.
And there's certain
You have
things
no
that
experience.
you could think you all that, but we're still learning stuff. Things change every day.
Yeah.
I mean, every other shift, I'm like, dang, I didn't know we could do it like that. Or, oh man, that's so more efficient. That's faster. So, you know, a lot of these new grads, they come out, you know, kind of on the cocky side. They're excited about the money. We're not really excited about the money. We've been making a little money for a little while, but let's find somebody seasoned to teach you, somebody who knows what they're doing. But the problem is they're quitting. They got sick from COVID. They died. They're exhausted. They have integrity, and they know how nursing is supposed to go. And when you're older, you're not going to adjust to this complete chaos. You can't. It's hard for me, and I'm 37. So to have someone who's been doing nursing for 40 years, they know how things are supposed to go. They know what the rules are. They can spit it back and forth to you. They're the one who teaches the other people, and now you want them to teach them death by fire and wrong? They would rather quit. And they have.
yeah.
I worked the ICU the other day, and of all the nurses that were there, it was only 2 of us that had been nurses over 10 years, and everyone else had been a nurse under a year. How scary is that?
Yeah.
ICU.
It's not how it's supposed to go.
I'm going to speak directly to the new nurses.
Yeah.
I've been a nurse for 14 years. I've started off in pediatric oncology, bone marrow transplant, to peds med surge, PACU, and 4 years ago I switched over to adult cardiovascular ICU. And you get to a place where you give and you give, and it's high demand, high stress, whether it was in the CVICU or in peds oncology. Do a self-check. Sometimes you don't realize how stressed you are until you get out of something. But when it gets hard to go to work, take some time for yourself. If you're in the middle of your shift, be present with yourself and remind yourself that self-care is important too. If you get to a place where you stop caring and you're only there for a paycheck, do a self-check. Give yourself some time. Doesn't mean you have to step away forever, but you need to take a break because there's a reason that you got into this profession. And sometimes you need that step back to reflect, to remind yourself on this, because they will ask and ask of you, and as long as you're giving, they won't stop. That's it.
Are there any other messages that you would send to our politicians or hospital leadership or just the general public? You both have said a lot and really incredible things, really valuable input. I'm just wondering if there's anything else in your mind.
I wish they were only as brave as us.
Yeah.
Because we left our families, we got up, went in those hospitals. A lot of us got sick. Some of us are not even the same anymore. And they sit in those chairs, they make these laws, they make choices. And I'm not saying that everything that they do is wrong, but I just think it's really sad that we faced all that we faced and we went through all that we went through that we've kind of been going through for years, but tolerating it.
Shine the light on it.
Yeah.
Because this was just cool and unusual. And then no one would even come outside. Maybe they should learn to fight like a nurse. Learn to be brave like a nurse.
You on Raw? If you never heard a mother or a wife wail for their loved one, if you have never had to hold someone's hand and lie to them, tell them that they were going to be okay, knowing that they were not going to be extubated and that they were going to be dead, don't tell me anything about it, what it means to care, and at least have the common decency to come out and talk. We walked into those rooms over and over, and it was not for... It was... It takes a piece of you. Everybody took a piece of me. That doesn't go away. And you can't make it okay.
It doesn't.
Pass the bill. Pass the bill.
Until you have FaceTime with somebody's family because they can't even come and say goodbye. You're literally FaceTiming.
Just come to the door.
With somebody's family because they can't say goodbye. You're literally answering your patient's cell phone because they can't read and they're telling you that it's their child, and just lie and tell my son that I'm okay. You know how hard that is? When your son and my son is the same age? You know how hard that was to lie to that kid? You know how hard it was to go home and come back the next morning and know that her 5 kids are motherless? And it wasn't just old people. It's not just people with comorbidities. It's young people as well. You know, it's families. One family, the mom comes in this week and died. The dad came in next week. Until you held a person's hand, because they can't even have their family, until you had to really go through that and call that family and hear them cry, or even before COVID, you know that they're gonna come here and they're gonna be devastated. Literally, like, you can't come out and talk. It's a small ask.
Come to the steps. We walked in the rooms. Come to the steps.
Yeah.
Small ask.
Well said. Well said. One last question for you, if you don't mind. What keeps you both in this career, and what are your plans for your careers if nursing does not change?
I always wanted to be a nurse. I used to nurse on my teddy bears. It was always a passion for me. At one point in time, I really think 100% nursing was my passion, but I'm so tired. And even though I'm tired, just because you're tired doesn't mean that you lose your passion. It's just getting harder for me to smile. It's getting harder for me to be okay. It's getting harder to continue to go back to the same situations, because doing the same thing over and over again without change is the definition of insanity. So I am definitely hoping that some change can happen, but if not, I may have to make a change, because at the end of the day, I have to take care of myself, because my family is my priority. And well, myself and then my family, because if I'm no good, I can't be any good to anyone. And this is just not healthy, and the nature of healthcare is scary right now.
Yeah.
I just finished up a contract in New York. It's going to take the next 2 months to care about me. And at the end of that 2 months, we'll see. I don't know.
And I'm currently PRN because I feel like I said before, I have to be able to go in with the right attitude, in the right spirit, ready to do my job, because the patients did not ask to be sick. I have to go in there and I have to perform like a professional. And I need time in between my shifts to recharge and regroup, to come back and be able to say, hi, my name's Nina, I'm your nurse today. How can I help you? What can I do for you? So knowing when to take a step back. Yeah. So that's where I am, and I'll make a decision based upon what they do.
Yeah. Well, I know it doesn't mean the same as one or ideally many of those politicians coming out and listening to us, but I mean it sincerely when I say you both have been critical. I so appreciate you sharing, and I would love to put this whole video up on my channel and share it wide so others, nursing students, other nurses, hopefully politicians and others hear it and make changes as well.
Absolutely. So, thank you for listening.
Yeah. Sincerely, your interviews have been probably the most meaningful that I've had all day. So thank you.
Anytime.
So much for sharing. Do you mind if I see your signs one more time, just so I can really capture it all?
On the nursing, we can't.
Thank you.
A lot of times we're only able to talk to each other.
Yeah, because we're the only ones who really kind of understand what it's like to walk in those rooms and
talk to your family like, ooh, that was heavy.
Yeah.
That's dark.
And sometimes it's like, so I'm gonna drove my car off a bridge on the way home because I can't do this anymore. And I've been working out, doing push-ups. Maybe we should think about stripping. Stripping? Maybe we just lose all our morals, because clearly empathy, sympathy, and love and compassion doesn't get you very far. And education. Maybe we should have gone the easy way out and learn how to swing. Just kidding. That's a joke. It's a joke. I'm married. My husband will kill me. No, seriously, we did this because we wanted to do it. We went into it because, like I said, we were filled with love, filled with compassion, and ready to make a difference. And it's hard to go from wanting to make a difference and you literally just feel like you're trying to survive through the day.
Yeah.
It's not fair.
Sure, you see in the ER, it all kind of.
Yep.
Yeah. The other day, my last shift, I went down, I got floated to ED. They had like 26 bed holds. Med surg just packed, hospital on diversion, nowhere to put them. Patients complaining about how hard the stretchers are. And in my mind, I'm thinking to myself, maybe just be glad you have a stretcher.
Yeah.
They still have people in the waiting room that haven't even been seen.
Yep.
Like
5 hours later.
I did not say that. I offered them, I said, is there anything else that we can do? We're trying to get you a room as soon as we can. But we just don't have any beds.
Yeah.
26 bed holds.
Yep. You mentioned passing the bill. I've seen at least a couple of bills mentioned on Science today. Do you know much about them?
I do.
Yeah?
Hand me my phone.
One is about safe staffing ratios, and the other is about violence against healthcare workers.
Thank you so much for sharing so much of your time with me as well.
Oh, you're welcome.
Yeah.
I don't know, I kind of feel a little disenchanted. Like that was, we should all have cancer for as much smoke as they blew up our you know what? I told her before we came here, I don't think anything's gonna change. But at least to know that it's not just us. It's not just us having this conversation every day after work.
Yeah.
And being around other people definitely,
camaraderie, that helped. But this was a slap in the face.
Yeah.
It's HR 1195, Workplace Violence Prevention for Healthcare and Social Services Workers Act. And the other one is for safe staffing. Oh, the other one is HR 3165/S.1567, Nursing Staffing Standards for Hospital Patient Safety and Quality Care Act of 2021.
Okay.
So those are the two specific bills.
This wasn't a vacation. This was
And it's kind of sad because I have some nurses that are currently on vacation in Mexico, and they literally were like, girl, we hope that works out for y'all, but you know, I just want to say one more time, people think this is about money. It's not about money. Safe staffing protects patients from having poor care, and it protects us from being at risk for, you know, making a mistake because we're so overwhelmed. And then workplace violence, I mean, we shouldn't have to come to work and people are fighting us and we have to have panic buttons on our badge or panic, you know, some hospitals have that, some don't even have security. And I mean, people are really being harmed, and we didn't come to work for that.
Yeah.
I'll take it to just basics. I came in this job to care for people, and when you're that overwhelmed, I feel bad when I can't be there. I feel bad that, you know, I've been in this room all this time. I haven't seen this other patient, X, Y, and Z. And just like now with legislation and criminalization of nursing, I mean, I've seen ads for malpractice against nurses and monitoring, like negligence for monitoring. How can you then, you're setting me up in a system to fail and be criminalized now, because now there's a precedent set for something I can't win at.
Yeah.
It's simple math. You're only one person.
And there's no statute of limitations.
And
So I could have did something 10 years ago, not even remember that, and now you're bringing it up and trying to put me in jail. So when I think about being in jail and being with my family, I'd rather work at Target.
Yeah. Like, how many times have you done an override? How many times have you done an override in the ER, in the CVICU? It's going down. Like, you know, they're in the middle of rounds. Hey, X, Y, and Z is going on. Can I get that out? You want me to give some albumin? Okay, and then you give your Post-it note over to the physician, like, hey, I need these orders. Like, how many times? But now we can't do that. There's no safety.
Yeah.
And then if we don't do that in an emergency situation, then there's a delay in care, and then you die. So there's this choice I have to make. Do I follow the exact protocol? Because if I do anything wrong, they're going to say, you didn't follow the protocol. Or do I kind of break protocol, do what needs to be done to keep you alive? And 99.9% of the time, that works.
Or wait for them to actually put it in, and then delay the care, 1. 2, put me even more behind my schedule, because now I'm having to babysit and wait for this order.
And then they still die. And they still die. You forgot about that.
No, and then they're like, why wasn't this done? Well, you didn't put the order in. I don't feel safe to execute that anymore.
Yeah.
No thanks. I worked really hard in nursing school.
And they'll say, look, Dr. XYZ, he doesn't like to put in orders. Well, I don't like to get felonies, so I'm gonna need him to put that order in for me. And I've had to become that person. I was always this really sweet, mild-mannered person, and now you have to be nursing students, honey. If it ain't for the meek and the mild, you have to say, I definitely understand where you're coming from, but you have to understand where I'm coming from, and I have to be safe, and I'm trying to give the best care. And the policy states that you need to put in the orders. I'm a nurse. I'm going to work within my scope of practice, and once you put that order in, I will gladly give that med. Or if you're in a situation in which you don't think it's a good idea, like I was told by a provider a month ago, I would say about a month ago, oh, I think that patient is having anxiety. I think I'm going to put in for some Ativan. I had to actually ask the provider, can I talk to you outside for a second? And I said, I can't even feel his pulse. His last blood pressure was 80/40. He needs to be transferred to ICU. I absolutely am not going to give him Ativan, because he will surely meet his maker, Jesus, Allah, Buddha, whoever he believes in. That is the worst idea possible. So you have to even be able to go head to head with providers and tell them, yeah, I'm not doing that. We're not going to do that. And I didn't do that. And you know what? Within 5 minutes, his IV was lost. He had 2 IOs, and he was intubated and sedated on a ventilator. We literally made it just in time, transferring him from unit to unit. Had I would have given that Ativan, I would have killed that man, and guess who would have got in trouble? Me. I would be on the news, not her, even though she told me to do it. So, you know, people sometimes think I'm being mean, but One other thing, nursing students, just because the doctor wrote it, that's never really a good idea to do anything. You do what makes sense. You do it safe. You don't know, you look it up. Do not think that you're all that. Look it up. I've been in the game for 12 years. If I don't know, I look it up. Or I find somebody sees it and asks, where's the book, where's the guide, where's the manual? Look it up. Because it'll save you some stress. I've never killed anybody, knock on wood. I've never killed anybody. I've never made any horrible mistakes. But I will stand up for what I believe in, all the way down to, okay, well, we're gonna downgrade that patient. Just turn the amniotic on drip off. Okay, no, I'm not doing that either. Because when they revert into that rhythm, who's gonna help me clothe that patient? Gotta protect you. So if you're not ready to stand up for yourself, then maybe you should try something else, because that's what it is right now. You have to tell it like it is. Very nicely, very politely, but at the end of the day, I have to take care of my patient, and taking care of my patient is taking care of myself and standing up for myself. So go ahead and write that order, and no, I'm not gonna do that.
Yeah.
Thanks.
Yeah, that's wisdom right there. Seasoned nurses.
End on high note.
Yeah.
I know.
I know.
There will be good days.
There will be.
There will be good days. There will be days where your patients laugh, where you cry with them. There will be old grannies that call a pure wick a corn cob between their legs. Like, you will sit with families braless at the nurse's station overnight waiting for their babies. There are rewarding sides to this job. You will make some of the best friends and meet some of the most caring people ever. Because the thing about it is, if you have a tough job, if you have a good team, those nurses become your family.
Yeah.
Yes.
And so it helps the bad days, but there are also good days.
Yeah.
They don't involve pizza parties.
Some patients do get off the vent. Some patients literally come in and you're like, I really don't know about him, he's shaky, and they walk out. Those are the days that make it rewarding and all the way worth it.
Yeah.
There will be days you throw a pizza party because your patient pooped after 10 days.
He pooped. All right.
So there are good days. There are laughs, there are smiles, but there are going to be some rough days.
Yeah.
Get excited about farting being a precursor to poo. Oh, he farted. Yes. Poo is coming.
You both are sincerely incredible. I flew all the way from the West Coast, and just being able to chat with both of you and get this down made my whole trip worth it. So I mean that sincerely. Thank you for all you do. Thank you so much for sharing your time with me. And I really hope that this march does provoke some change. Maybe not today, but hopefully in the near future.
Absolutely.
So.
Thank you for what you do.
Thank
Yeah.
you for what you do. Bringing awareness is a big deal. And that was our fear, that it
And
wouldn't
guidance, like, there is a new generation coming, and they need to be prepared.
for the good, the bad, and the ugly.
Yeah, exactly.
Thank you so much.
Yeah, thank you.
Hey, what's up, Internet? My name is Reed. I'm an ER nurse from the West Coast, and I went to the Nurses March this month, May 2022, in Washington, D.C., to capture these and other nurses' stories, their frustrations, their passion, and their pain. I was worried that their voices, which deserve to be heard and listened to, might not even be heard at all by those in power. So I went there to do all I could to make sure that would not happen. I mean this in the most absolutely genuine and sincere way possible. I walked away legitimately and to this day still feeling unworthy to have captured these interviews. But you know what? No one else, outside of those of us who were in the march, was capturing their voices and their stories. Certainly not our politicians, certainly not our healthcare executives. Our politicians in DC, every single one of them, missed out on hearing these voices. I got literal goosebumps multiple times listening to these stories, and again when compiling these videos, and I knew these voices not only deserved to, but needed to be heard. And still do. They still deserve to be heard. And I will do all I can to make sure they are. So to all of our politicians, I know DC is busy. I know there are many fires, so to speak, going on in the world. But healthcare workers just carried the brunt of the worst worldwide pandemic in a century and literally kept this country alive and running over the last 2 years. And you all couldn't even be bothered to merely acknowledge our presence when we peacefully shut down the busiest roads in Washington, D.C. for hours. None of you could even bother to wave at us from a balcony or a window, much less meet with us and hear these stories for a few minutes. Again, we shut down DC traffic for hours and got escorts from the Secret Service and Capitol Police, so you certainly knew we were there. I also checked your public calendars. It was a weekday, May 12th, 2022, when we were in DC for this march, and the House and the Senate of the US Congress were both in session, and the President was at the White House that day. Oh, and it was International Nurses Day, and it was the last day of National Nurses Week, and it was Mental Health Awareness Month. Oh, and it was the very same day our politicians acknowledged that 1 million people had died of COVID in the USA. But even though nurses were some of the hardest hit and most personally affected by those numbers of deaths, still none of our politicians would even walk outside and acknowledge us for even a moment at all. The message that we got from all of our politicians was, we know you're here, but we're far too busy to be bothered. Which begs the question, if you all won't even listen to tens of thousands of healthcare workers who personally were representing hundreds of thousands of healthcare workers who knew about this nurses' march, then whose voices do you listen to? Whose voices are more important than these tens of thousands of healthcare workers who just bore the brunt of this pandemic and who walked right up to your doorsteps simply hoping to be heard for a few minutes? So if you all wouldn't even take 5 minutes to hear from tens of thousands of your healthcare workers, how can anyone in the general public expect to be heard by you for their problems and their issues? How can any of your constituents in the general public ever expect any positive changes in this country? If you won't even listen and acknowledge us when we're on your doorstep, how can you say that you are truly their representatives or our representatives? More than 10,000 nurses traveled using their own money and their own precious free time and energy, and all we got from our decision makers was one pre-recorded video from one politician that day. And to be honest, I'm sure that video was very well-meaning, but it was from a politician whose name I didn't even recognize, and I am somebody who watches US politics very closely. So that's it? That's the best DC could do for 10,000 plus nurses who showed up on their doorstep? Each of you had constituents who expected you to make an attendance, or at least simply acknowledge our presence somehow. And beyond the 10,000 nurses who showed up, there were at least hundreds of thousands of nurses who couldn't make it but who knew of and supported this march from afar, not to mention the other healthcare workers throughout the country. All of us who were paying attention noticed your absence. These nurses and other healthcare workers deserved so much better than your response to our march. All of our healthcare workers deserve so much better than that. I am largely going to keep politics out of this channel because I'm really trying to focus on building up the next generation of nurses and other healthcare workers, and also to provide some comedic relief on this channel for the stresses that we endure as healthcare workers. But I absolutely cannot be silent, especially as I am publishing these videos. I cannot state how disappointed I am that nurses like those in this video only got my ears and my camera rather than the ears of our country's decision makers like they deserved. All of you, Democrat, Republican, I won't discriminate here, all of Congress and the White House, both parties honestly failed us this day. Do better. Now, on a positive note, to the nurses and nursing students and other healthcare workers that let me interview them and share their stories from the heart, every one of you sincerely are amazing. Thank you, thank you, thank you for sharing and trusting your stories with me. I am sorry that more people didn't listen to you on that day, but hopefully many will hear your recorded voices here on these videos. And thank you to every single person who showed up at this march in support or who supported from afar. And for every nurse or healthcare worker that was not there but wished they could have been there, thank you so much for your support. All of us healthcare workers, nurses, providers, and everybody else needs to remember we are stronger together, and there are powers in this country that would love to divide us over petty issues because they know we are stronger together. And if we are going to make real changes in healthcare, the impetus for that has to start with us, and it starts by us being united to tackle these issues. If any of you viewers want to and are able to support this channel in any amount so I can continue making videos like this, I greatly appreciate donations of any amount, and you can donate easily at donate.nursery.com. But if you can't donate, absolutely no worries. That said, if you do agree with me that these nurses' voices deserve to be heard, please go ahead and share this video with others. I've also got many more videos coming this week from the 2022 National Nurses March in Washington, D.C., and many more videos coming out very soon to help nursing students and newer nurses. So please, I encourage you to subscribe. Thank you so much for watching and your support, and thank you again to everybody who made it out or who otherwise supported the nurses marching in DC. I love every single one of you. Sincerely, from the bottom of my heart, thank you for watching.